Hello everyone, welcome to MedSense, where we make medicine make sense. Today we are going to be discussing the anatomy of the prostate gland and everything that pertains to it. So for the purposes of introduction, the prostate gland is a small walnut-shaped gland in males, and it is part of the male reproductive system. For the location, it is located in the pelvic cavity, below the bladder, and in front of the rectum, and it surrounds part of the urethra. That's the location of the prostate gland. So this is supposed to be a diagrammatic representation. From the diagram you can see the prostate where it is lying under the bladder, and then from this video you can see the prostate as well under the bladder and the surrounding organs, and also the urethra. You can see it continues from the prostate and enters into the penis. Relations of the prostate gland. Anteriorly, it is related to the pubic symphysis. Anteriorly. Posteriorly, it lies in front of the rectum, which makes it palpable during DRE. That's digital rectal examination. It is separated from the rectum by the non-villous fascia. That's what separates the prostate gland from the rectum. So during DRE, you don't actually touch the prostate gland, it's this fascia that you touch. The surfaces of the prostate. Anteriorly, it lies behind the pubic symphysis like we discussed. Posterior surface, it is broad and flat. It is related to the rectum. Now, remember that it is the posterior surface that you touch during DRE. Now, this surface has a median vertical groove that separates the right and the left lobes. Just like I said, it is an important landmark in DRE. Now, inferior lateral surface is related to the levator ani muscle. The lobes of the prostate gland. It is divided into 5 lobes by the urethra and the ejaculatory ducts. Now, in the next slide, you will be seeing the diagram where the urethra and the ejaculatory ducts divides the prostate into 5 glands. Now, what do you have noticed is that these divisions are mostly embryological. They are mostly embryological and only recognizable in infants and at early life. So let me quickly list out the lobes of the prostate before we look at the image that would make things clearer. We have the anterior lobe, which is also known as the isthmus. We have the posterior lobe. We have the median lobe. Then we have the right and the left lateral lobes. What do you have note? The right and the left lateral lobes are the only lobes that persist in adulthood. When the individual has grown of age, the right and the left lateral lobes are the only lobes that persist. That is why during DRE, it's only the right and the left lobes that are palpated. So this picture is supposed to give a clearer view of what the lobes look like. These are the lobes of the prostate. So as you can see, all the lobes are represented here. You can also see the ejaculatory ducts and the prostatic urethra running on top of the prostate. So this is a picture that is supposed to show you all the lobes of the prostate. Remember, all these lobes are only seen during infancy. So let's do a quick rundown on the lobes and see what each of them look like. For the anterior lobe, it's in front of the urethra. It's fibromuscular with little glandular tissues. For the posterior lobe, it's behind the urethra and the ejaculatory ducts, obviously, and that's the lobe, as we had earlier said, that is palpable in DRE and is commonly affected in prostate cancer. The median lobe is between the urethra and the ejaculatory ducts, and it enlarges in BPH, as we saw from the diagram. The right and the left lateral lobes are on either side of the urethra, and they contain most glandular tissues. Remember, we agreed that the right and the left lateral lobes are the only ones that persist in adulthood. Now let's look at the zones of the prostate. There are 4 glandular zones, which are the peripheral, the central, the transitional, and the preprostatic zones, and there is 1 non-glandular zone, which is the anterior fibromuscular area. These are the zones of the prostate. but for emphasis sake, the 4 glandular zones are the most important zones of the prostate. Now let's look at the first one on the list, which is the peripheral zone. This is the first glandular zone of the prostate. Now, this is the largest zone and it originates from the urogenital sinus. It branches out laterally from either side of the distal urethra. It contains 70 to 75% of prostatic glandular tissue. Take note of this, the amount of prostatic glandular tissue it contains, and it is the site of origin for 70% of prostate cancer. Very important too. It's the site of origin for prostate and 70% of prostate cancer. It is commonly affected by prostatitis but does not contribute to BPH. This zone is left behind in simple prostatectomy. Still under the glandular zone of the prostate, the next on the line is the central zone. This is a glandular area which surrounds the ejaculatory duct. So the area around the ejaculatory duct is what we are referring to. It is in contact with the ureter as well. That's true. It originates from the Wolffian duct in embryo. It contributes 25% of glandular tissues and the site of origin of 10% of prostate cancers. Remember, it contributes 25% of glandular tissues and is 10%, its origin of 10% of prostate cancers. It does not contribute to the formation of BPH. Now we are looking at the transition zone. Now the transition zone, this is the smallest zone and forms less than 5% of the normal glandular tissue. It lies adjacent to the urethra at junction of the proximal urethra and prostatic urethra. This zone and other periurethral glands are the site of BPH. So finally we've seen the site that BPH originates from, and 20% of prostate cancers originate from this zone. For the non-glandular zone of the prostate, it is located anterior to the urethra. This zone is composed primarily of dense fibrous tissues and smooth muscle tissue fibers with no glandular elements. Functionally, it plays a supportive and contractile role. That's the major function. During ejaculation, the smooth muscles within this region contract to help expel prostatic secretions through the urethra. Now, what this tells us is that the major contractile function of the prostate during ejaculation is primarily done by the non-glandular zone. Now let's look at the capsules of the prostate. There are 2 major capsules. We have the true capsule and the false capsule. Let's look at it in detail. Now the true capsule is formed by condensation of fibromuscular stroma around the gland. It is part of the prostate itself and blends with the stroma of the gland. So the reason for the name is because it is part of the prostate. Now let's look at what the false capsule looks like. Now for the false capsule, it is also known as pathological capsule. So another name for the false capsule is pathological capsule. It is formed by compression of normal prostate by fibromyadenomatous hyperplasia of transitional zone. It is left behind when enucleation is done during prostatectomy. Let's discuss the dimensions of the prostate. Now for the weight, it weighs between 18 to 26 grams. Very important. The shape, it's walnut or conical. The width, it's 4 cm wide. And then for consistency, the consistency of the prostate is firm, not soft. When it is soft, it's a pathological condition, so the consistency is firm and not also hard. For the blood supply is majorly by the inferior vesical artery, that's the main artery, and then there are branches from medurectal and internal pudendal arteries, that's the blood supply of the prostate, and it drains into the prostatic venous plexus, that's the venous drainage, prostatic venous plexus draining into internal iliac veins. For the nerve supply, the prostate is innervated by the prostatic plexus, which is derived from the inferior hypogastric plexus. It carries sympathetic
and parasympathetic fibers which control secretion and smooth muscle contractions of the prostate. Now let's look at the embryology of the prostate. Very concise. The prostate develops from the endodermal urogenital sinus during the 10th to 12th week of gestation. Endodermal epithelial buds from the prostatic part of the urethra invade the surrounding mesenchyme, which gives rise to the fibromuscular stroma. This development is regulated by androgens, which is essentially for the differentiation and growth of the prostatic tissue. Now, you cannot write effectively about the anatomy of the prostate without discussing the embryology and the histology. Now, this is what the histology looks like. We have the glandular tissues, the fibromuscular stroma, and the prostatic lumen. This is all about the histology of the prostate. Now, if you've watched up till this point, thank you very much for subscribing to MedSense. This is where we make medicine make sense. See you on our next video.